Welcome, everybody. This is the second in this series whereby Mark, Vernon, and I talk about therapy, good and bad. For those of you who don't know us, Mark Vernon is a man of many parts, philosopher, but also a practicing psychotherapist. And it's the philosophy thing, I guess, we have in common among our other things, including our friendship. I'm a philosopher by background, and I also have an interest in systemic forms of therapy, particularly through constellations or systemic mapping, as I sometimes call it.
Hey Robert, I should just leap in as well. Thanks very much for
Yeah,
that. And say also we do a philosophy slam, which is an improvisation around ideas, and we do them online as well. So watch out for those appearing online on my YouTube channel and elsewhere.
yeah. Thanks for saying that, Mark. That's good. Good plug. So last time, Mark, you and I spoke about the notion of trauma in therapy, and that's still online on your YouTube channel if people want to have a look at that. But today, I mean, as I said to you, I was particularly interested in exploring this notion of the frame. So I'm going to say a little bit about it, and then maybe we can have a rally backwards and forwards about it. But the frame, the reason it's important, I guess, in psychotherapy and psychoanalysis, for that matter, is that what it's about is creating basically a safe space or psychological safety for the conversation or the interaction between a client and a therapist to take place. And that frame takes some sort of practical empirical forms as well as some more psychological forms. So practically speaking, and Mark, you'll talk about this, a frame would be the fact that you meet at a prescribed time and you both turn up on time, basically. And secondly, that prescribed time is often the same every week. Not always. I mean, some therapists and other practitioners in this space vary a bit, but typically speaking, you'll have a slot, and that slot will also have a fixed amount of time, usually 50 minutes. Some people have a bit more, but those are some of the sort of empirical ways, I suppose, in which the safe frame is created. And the idea is that notion of consistency, regularity, and so on produces trust and is one of the many, many elements that can facilitate a sense of safety or not having to worry about things. Whereas if, for example, you're a therapist who suddenly cuts the therapy, in short after 20 minutes, you leave your client high and dry, they might be in the middle of something, significant, and so on. So, I mean, that's one of the kind of most basic ways in which the frame is established. But there are kind of more subtle, maybe less empirical, less obvious ways. So, for example, the silence of the therapist or the refraining from commenting on everything or intervening all the time is also a way in which the frame is maintained. The idea being that the therapist or practitioner, quote unquote, holds the space. So this is time for the client to speak, and the therapist is just allowing for that to happen and trying not to get in the way of it too much. So I suppose it's the sort of holding the silence, maintaining the frame, which I suppose is the second most important way. So those are a couple of the most important ways. We'll talk about others, of course, but Mark, maybe you want to just comment on those before we get into some of the nuances around it, I guess.
Yeah, no, that completely makes sense to me. I mean, it's quite ritualistic. And I think that's another way in which the frame facilitates therapy, that same time, same place, that regularity quite quickly builds up. And like anything that's ritualistic, it produces a shift of consciousness, and that enables both the therapist and the person they're working with just to drop into a slightly less conscious, less obvious mode of relating to things. And from that can come new insights, new feelings, new perceptions. And so I think of the frame too as definitely about creating this notion of a safe space that has this reliability, as you're saying, but also about that also facilitating moving towards things that otherwise don't feel so safe, paradoxically. That which we've struggled to bring to mind, and when it comes to mind, it can feel overwhelming, frightening, have these kind of qualities. And the regular pattern, a bit, it's a form of hypnosis, I think, and facilitates the different kind of conversation that you have with your therapist, that a therapist has. It's a peculiar relationship, a very intimate relationship, but one in which alternative, different, unexpected insights arise very much because of the way that the relationship is handled. Sometimes in research into therapy, it's this question is asked, what makes the therapeutic relationship work? Why does therapy work? And often the relationship is discussed as a key thing rather than, say, the theories. And I think that the theories too are kind of important, but they too can sort of facilitate the frame, because what a theory does is it gives the therapist particularly a sort of roadmap, so that they can feel they've got something to suggest, somewhere to look. And ideally, I think many therapists nowadays would suggest that actually you need access to several theories, some Freudian ideas, some post-Freudian ideas, some Jungian ideas from attachment theory, ideas from the developments across the 20th and now 21st centuries. And it's because no one theory has it all at all, but many theories will enable you to suggest, this move, or what about that possibility? And that sort of sense that there's guiding from the traditions in psychotherapy, that too, I think, facilitates the frame, and so helps someone get the sense that they can go to these less safe feeling places with some sense of safety, paradoxically.
Yeah, I like that. That's I really enjoy that description of it, Mark. The safe frame allows for unsafe material. I think that's a really elegant way of putting it. It also struck me that there's probably an important kind of third area we ought to reference in terms of the definition of the frame, which I suppose goes back to the notion of Gestalt therapy in particular, because the word Gestalt in German, as I understand it, means frame, basically, or kind of the framing, the setting up of something. And what we're talking about there is the way in which the client in particular might frame an issue, or frame their world, or frame a problem. So if I frame my world as one in which I'm always unlucky, or always losing, or I'm coming off worse in every situation, that's my kind of frame on the world. And of course, and then it's the job of the therapist to interrogate that, expose it, perhaps adjust it, and indeed to reframe. And I suppose, if there's one, extra bit of value that therapists and other practitioners provide, it is the reframing for the client, so they can see their world through a different lens. I mean, I'm often reminded of that famous quote by somewhere in Proust. I don't know where it is. I mean, finding the quote in Proust is like finding a needle in a haystack. But he basically says something like, "All that you need is to see the world afresh to be happy," because the world can be seen in so many different ways, and we all carry our frames with us. So that's the kind of inner framing we're doing. It's like we have a pair of glasses sort of behind the eyes, as well as in our case in front of the eyes as well. So I think it's worth sort of touching on that we are trying to reframe as much as possible, or it certainly interrogate, question, gently shake the frame, I suppose, with which the client arrives, because after all, it's often the frame that the client presents with that is basically the kind of cage within which they're sort of trapped, isn't it? So
yeah, look, I think this is actually a really huge part of it, because it's one thing to understand where your troubles have come from, but it's another thing to move into a new world. And so reframing your life is, in a way, the greater part of the task, because when your imagination has settled down, it's like a pair of glasses that will bring certain things into view, but no matter how much you squint, may not bring other things into view. And so reframing your imagination is very, very difficult. And I think typically only comes about through some kind of suffering. I think Jung said words to this effect, that that healing only comes in hand in hand with suffering. And partly that was referring to what we were, initially talking about, looking at difficult things in a safe context. But then comes a different kind of suffering, which is having to move into uncertainty, not knowing. And I think this is really a huge issue, actually, with contemporary approaches to mental health and psychotherapy as well, because there's a huge emphasis, and you can understand completely why, that links safety with positive affirmation. That says, I'm validating your story, understanding your experience, giving your sense of your suffering can be met, and understood and known. And that's clearly important. But I think unless there's also the challenge to reframe, to step into a place that can feel unsafe because of its novelty, actually, not because of its familiarity. So much suffering initially is because we have inherited from the past experiences that just are sort of on repeat and keep us trapped in the cage, as you say. But they're kind of familiar, even if deeply troubling and at times terrible. But stepping into something that's new presents its own challenge. I've even wondered, just to sort of reach for something that's very much in the news at the minute, and I obviously don't know because I'm not either of their therapists, but I do wonder with what we see with Harry and Meghan. It does feel as if they have, in a way, you might say, we'll certainly say Harry, because he's said a whole lot more in his book. His suffering has been met, it's been understood. And he's got articulate about it, and he draws on various theories in order to develop it, and that's important. But I wonder whether he's reached the second stage yet, which is this challenging his story now that he's familiar and feels safe enough with it. If he does, a new story might begin to emerge, and part of what feels like actually the tragedy of what's going on with them, at least now, is that in a way he's spoken too soon in public, and I wonder is at risk of actually trapping himself in his story that he's become very familiar with and very fluent around now, but hasn't sort of held back until a new frame might emerge, a new gestalt, which requires all the safety of the first effort, if you like. If that makes some sense.
Yeah, it does. And it makes me think this notion of the frame that we hold on the world is a bit like skins that we have to shed. In a way, there's no end to that process. We can always improve, deepen, explore further. We both have a philosophy background, Mark. It does remind me a little bit of Kantian philosophy, this idea that, okay, we'll never probably know the final truth of things. We'll never, although we pursue, psychotherapy, psychoanalysis is about the pursuit of self-knowledge, if nothing else. There probably is no final answer to that. The question, who am I, will never be complete, I don't think. But at least what these frames do is they give us understanding. They give us provisional understanding to move to the next phase. And I think maybe the task is to make sure that they're somehow enabling, and of course, what you say about Harry there is, he's shifted from one, frame, which is maybe one of accepting the world around him, the systems, the monarchy and whatever, to another one, which is more or less rejecting it. And, I think that perhaps seeing himself as a victim of it in some way. And then perhaps there will be a third frame, which will be sort of enabling in some way.
Yeah, no, you certainly hope so.
Yeah. The other thing I just wanted to say, which maybe I should have said by way of introduction at the beginning, that, although the frame, some practitioners are pretty militant about the frame, you must turn up on time, and they'll even cut you off kind of mid crying bout if, once 50 minutes has come up. I remember when I was in psychoanalysis for many years, and I would sometimes be in the most, soul-searching moment, and my analyst would say, "And that's time." So, okay. But it should be pointed out, actually, that even Freud and certainly Jacques Lacan, the famous French analyst, had a much a less kind of militant view of it. I mean, there are stories of Freud, for example, going for walks with his, patients and just chatting, as part of the process. And Lacan, almost from my recollection of his kind of clinical work, would almost deliberately kind of stop sessions and basically say, we're not getting anywhere, so I'm giving up on you for today, or would do that in order to jolt the analysand, to use the technical term, into producing some sort of unconscious material. Because the trouble with the frame for Lacan was that it's so safe that it can collude with the client's own sort of defense mechanisms and inability to engage and all the rest of it. So I think it's just worth saying that as well, that although clearly it's riskier for both sides of the equation, there can be moments perhaps in which some shaking of the frame might be valid. I don't know what you think about that, Mark.
Yeah, no, I mean, I think that there's a book which was certainly I read after I qualified as a psychotherapist, called The Psychoanalytic Craft, and it's designed for people that have sort of done a training and are now really trying to find their own voice as a psychotherapist. And one of the fascinating parts of it is that at the end it interviews, the author interviewed a bunch of psychoanalysts who are very important now. If you do a training, you read their papers and so on, and particularly ask them how they work. And it's very revealing that they all work far more creatively and variably than you might presume, and certainly when you're a sort of novice therapist. And so the part of the point of the book is to enable you to really internalize what at first you learn as kind of rules, the 50 minutes and so on. Or it's 45, I think, in the US. So that immediately shows up that things can be different. But more subtly, what it's trying to do is to suggest that actually there's a kind of inner frame as well as the manifest frame, the empirical side of it, as you pointed out to start with. And that is how the therapist themselves feels about holding the space. And inevitably at first, you need more reliance perhaps on the external structures, so you worry a lot about your room and how the therapist might enter the room and leave the room, and all that kind of stuff really matters at first. But as you get clearer about this inner frame, your own capacity to respond, to hold, and to project a sense of safety, and all those much more subtle but ultimately more powerful things become developed in you. And the reason why they're more powerful is because they have this flexibility, that you can move much more with the flow, the energy of the session, and that makes it all that more responsive, and so less sort of manualized, less rigid. That's a whole other area actually, and the way that a lot of modern psychology gets very manualized, by which is meant that if you follow these procedures almost like a checkbox activity, bingo, better mental health pops up at the end. And that can help people in some ways, but much more subtly is again enabling someone to feel how you are able to move with difficulty, when to approach it, when to pull back from it, and so on. And that inner frame, which is much more elastic, but like a reed that can bend with the wind rather than one that might get snapped if there's a sudden gust. It's that which you're sort of trying to convey ultimately. And I think that figures like Lacan, with their critique of the too rigid frame, in one way that's what they were trying to say.
Yeah, I mean, you touch on there the feelings of the therapist or the practitioner, and I suppose that gets into, one of the most complex areas of all of this around the frame, which is the degree to which the therapist themselves crosses the frame into the world of the client with their own material, and vice versa. So, to use the technical jargon, transference and countertransference. In other words, so yes, we have the notion that of a frame, and frankly, that's also the frame in which the client or patient sits, and it's supposed to have a pretty tight boundary around it. So you're the client, you're in this frame. I'm the practitioner or therapist over here, and I'm not in your space. That there should be a sort of clear demarcation, as it were, between the two. And that's a clinical demarcation which runs throughout sort of medical practice. My material doesn't get mixed up with yours. There's no cross contamination of any kind. But and of course, at one level, at the clinical level, at the professional medical level, and so on, that is a sort of rule of professionalism almost, maybe the rule of professionalism. But of course, when we're dealing with human emotion and so on, when the practitioner, the therapist themselves has emotions and will respond to what's being said, their own material now takes on clinical import and value. So I'm sure you've seen this many, many times. I can speak of my experience again as being a analysand in psychoanalysis. My analyst would sometimes say, basically, when you say that, Robert, that makes me feel sad, angry, happy, confused, whatever. Because, although she was outside the frame, she's using her feelings, if not exactly to mirror me, at least to give me direct feedback on the effect I'm producing on her, which, of course, I am then supposed to reflect on and generalize from. It's like, okay, if I make my analyst feel, unhappy, sad, belittled, angry, maybe I'm doing it with other people too. So I need to watch that. So for me, that's the way, that's the point at which we're actually dealing with kind of two frames in the room, and the overlap between the two, and how we manage the overlap between the two. I've always liked, by the way, I mentioned this to you before, there's a phrase in organizational psychology, I do a lot of work, organizational work, as you know, which I think was coined in the 50s or 60s, which is self as instrument. In other words, as a psychotherapist, psychoanalyst, you don't have a scalpel, you don't have drugs that you dispense, you don't really have anything. You just have, a chair, basically, in a room and a door, and that's kind of it. But actually, the one instrument you do have, and your most subtle instrument, is your own body, your somatic response, your emotional response. So learning to work with that as a kind of index or barometer or weather vane or compass or something of what's going on in the room, assuming you can get some distance on it, seems pretty valuable. But of course, it's exactly where this notion of framing also becomes very, very complex, and the two frames become kind of intermingled.
Yeah, what you offer back is something which, as a therapist, you spend a lot of time sort of holding and trying to discern in the context of a session, because the idea is that whatever you offer back is in the service of the person you're working with. That'd be another way of putting what you're saying there, I think. Rather than you acting out your own responses to what's going on, whether that be a feeling of love, or a feeling of hate or something more destructive. You try and not just respond as you would in a normal kind of conversation, but think, look, so I'm feeling this. I wonder what that's about. How can I offer that back in a way that the client might be able to pick up, so they can stay with their material rather than suddenly be invaded by my material, which of course would at least rattle the frame, if not destroy it. It's one of the reasons why you have your own psychotherapy when you train, because you have to get to know your own responses. But also, it's also one of the reasons why ethics is hugely important. And some lines can't be crossed, like, say, sexual relationships with someone you're working with, because that completely, whatever else, for all other reasons that might be wrong to do with power and so on, it certainly destroys the therapy, because it's not offering something back in the service of the client, that's for sure. So but on the other hand, it is a subtle business, because you do, I think, have to, as you say, use the most subtle instrument in the room, your own response. And if you don't, then it deadens the therapy too. It's not a living thing. It's not two souls meeting. It's not authentic. And the person you're working with will feel that as much as anything else. So that too can strangely undermine the frame, because it no longer has that living quality of presence. but instead just becomes, well, dare I say, like speaking to an AI or something like that.
Gosh, I guess that's coming, isn't it? Well, maybe it's already arrived, AI therapy. But one of the metaphors I like around this is the idea that the session is a kind of laboratory. I mean, some people might hate that metaphor, but I quite like it, because the idea then is that you can practice human relationships with your therapist in a safe frame that allows you to get a sense of, how you might come across in the world outside the therapy room, and in a way in which, is safe, because the therapist isn't going to shout at you. I mean, the therapist might say, I notice that I want to shout at you, or I'm feeling, when you say that, I can't help feeling, a desire to tell you off, or even throw things at you. But at least there's the sort of framing of it, that things are put at one remove. So you on the couch or in the chair can say, oh, okay, that's the effect I'm having. I can use my therapist almost as a sort of crash test dummy in my practice, because I know the therapist isn't going to get drawn in the way my partner, wife, sibling, son, grandfather, might. So that's key, isn't it? It's the ability of the therapist to actually name the frame by saying things like, as you said, I am feeling this, or I notice my anger rising. It's the moment the therapist feels something, it's immediately having that kind of meta response, rather than giving into it in some way.
Yeah, and very much, and it actually reminds me of something which I don't think we explicitly said yet, but it's the notion of confidence, and keeping things in confidence, because again, that very much enables you to use the therapy session to say things that otherwise you'd be too ashamed to say, but to try things out too, and knowing that it won't go any further than the therapy room is really an important part of the safety that the therapist can offer in order to do that. It's another strange paradox in psychotherapy, that some of the best material you can read about psychotherapy is the case study, because the case study is what invites you into the frame, to see really what's going on, with this sort of moment by moment shift and change. But there's huge controversy about the publication of case studies, for exactly the same reason, and particularly more popular books, that there's no way that someone can agree to their material entering certainly the wider public space and knowing what impact that will have upon them. And yet, material that gets into the much wider public space is very beneficial for those who read it, and for psychotherapy itself, because it helps to educate the wider populace about the nature of our inner lives, in a world that often treats our inner lives too programmatically, I think, as if you just need to do this practice and then, this cause produces that effect, and doesn't see us as dynamic, organisms that have all sorts of reflexive responses that we do and don't understand. But yeah, the bottom line is that confidence, completely matters. And actually, sometimes someone might say to me as a therapist, isn't it hard not to talk about what goes on in the therapy room? And actually, it's not hard not to talk about it, because there's a sense of it almost being sacred, actually. And the minute in your mind you sort of start to feel something that happened in the therapy room sort of breaking out into your wider life, it's the minute you sort of push it back again, and because it feels like that would be trespassing on something that is very, well, not just precious, but it almost feels kind of sacred to me, as if, what's going on in a therapy session, in your work as a therapist, is, well, I was going to say the sort of the making of a soul. It's not that you as a therapist are involved in the making of a soul, but you're certainly creating the safe space within which a soul can develop and grow and flourish. The notion of midwifing comes to mind. You know, Socrates famously said that he was a midwife, and I think ancient philosophy was much more like modern psychotherapy, certainly in these respects. And yeah, so confidence and how that enables the frame, safety enables something to be born. Surely it's all part of this mix as well.
Yeah, absolutely. Yes, should have said it up front, probably. Confidence, confidentiality. It just reminds me, maybe this is just a final theme we can touch on. We mentioned AI earlier, but I had a incident recently where I was running a constellation online for a client, and of course a lot of that's been done since lockdown, and they said, do you mind if I record the session? And I said, I do mind. Would it be okay for you just to take notes? And the reason I said that is that I had an experience a couple of years before with another client who had asked to record. This is sort of beginning of lockdown, so we're all kind of getting used to different ways of working. And I'd sort of said, yeah, sure. They had recorded the session, and then I discovered they had circulated it online, and there was comments for it, and then they'd shared it with their partner and friends over dinner, and it became a sort of dinner party discussion with everybody kind of weighing in. Well, I wouldn't have said that, I would have said that. Oh no, she doesn't feel this, he's more like that. And that's kind of okay at one level because it's their material, I suppose. The session is for them. But at the same time, I felt that was a breach of confidentiality. I didn't make it explicit about not sharing the material that had been recorded. I thought it would just be for the use of the clients involved. And of course, as I say, because this was early on in lockdown, we were still kind of getting used to new rules of working. And I suppose some of these things hadn't firmed up in the way they subsequently had. But I think that's an interesting case. Now, the recording of a session and distribution of it is probably only on a sliding scale, really, from a client going back to their partner after a confidential session and saying, Mark said this to Mark told me I'm a narcissist. Of course, not that you would ever do that, Mark, but it is a sacred space, and at the same time, there's no legislating, of course, for clients talking about their material outside of the session, and kind of why should there be? We're not censoring that, but even though it is on a spectrum, it still feels kind of ethically not quite right to have sessions recorded, which are then shared. And of course, in principle, they are shareable the moment they're recorded. I mean, we're recording this; it can go anywhere, can't it?
Yeah, I mean, all that's very sort of subtle. I think you just got to go on the feel for it. If it somehow feels like it's misusing the session, it probably is. And again, I don't want that to sound too puritanical, because I think what this is also about is I mean, for example, I don't take notes of sessions, let alone record them, but certainly don't even take notes. And part of the reason for that is that we're, again, going back to where we started, this notion of the frame is about enabling us to get more in contact with less conscious material. And it feels like if you start taking notes, let alone if you record, you're immediately leaping back up to quite a bright level of consciousness, the explicit, the manifest. And certainly then if you take it out to a wider conversation, so it just gets knocked about like a tennis ball. That's just everybody playing out their own sort of fantasies around the material, not listening to something that otherwise might not be heard at all. And so trusting that that which is subtle, that which might almost be just like pass like a sort of fleeting moment, but actually might be the key thing. And so learning to be in a session with that kind of antenna tuned, I think is really important, and not feeling you've got to kind of get everything down and try and incorporate everything that's said, and that's the way forward. It's not. It's really quite the opposite to that, actually. So again, this whole business of note taking and recording, I think that's why it feels wrong, because actually it is, in extremis, it might destroy what would be really valuable in the therapy, actually, which is much, much more subtle, and so just gets overwritten by the bright lights. of recording and then banter about a session.
Yeah. Well, Mark, speaking of recording, I think our recording is probably coming to an end. I think we said we'd run this for half an hour or so, which I think we have. I think we've covered a wide range of topics there around this notion of the frame. So thank you for that, and we'll be back online, won't we? Continuing our conversation shortly.
Yep. Thanks for holding the frame. And one of the good things about the frame, which has a clear end, is that no doubt it sparks thoughts in those who listen. We hope it does. And do continue those thoughts yourself, of course, because they might well take you somewhere. But cheers for now, Robert.
Thank you very much, Mark.